The COVID pandemic has created a climate of heightened fear and anxiety, and with so many unknowns, expecting mothers are especially concerned not only about their health, but the health of their unborn babies. So here to tell us what to expect when you're expecting in COVID is GYN Dr. Evelyn Minaya. Thank you for joining me, Dr. Minaya.
Hi, how are you?
Good, good. What can you tell us about COVID and pregnancy by the numbers?
According to the CDC's latest statistics, there are about 23,000 pregnant young ladies with COVID. Remember, that doesn't necessarily mean that they have the disease. They're just testing positive for COVID. About 5,000 of those get hospitalized, and they are, remember, the CDC did not distinguish whether they were hospitalized because of COVID or they were hospitalized because of other obstetrical manifestations. About 200 or so women ended up in the ICU, and we had 55 deaths.
55 deaths. So,
55.
but are we sure those deaths are COVID related, or were they potentially?
Yes, those 55 deaths are COVID related.
Gotcha. We talk about pre-existing conditions making you more vulnerable and susceptible to the consequences of the virus. Is pregnancy one of those pre-existing conditions or not?
If you compare pregnant women to non-pregnant women, yes, we're more at an increased risk of severe manifestations of the COVID-19. If you compare just pregnant ladies, and in that population, we see that women that are either diabetics, asthmatics, obese are at an increased risk for more complications from the regular pregnancy women. Remember, in pregnancy, most women are healthy, they're doing their prenatal vitamins, they're exercising, they're having great nutrition. So most of the time, they're young, healthy women, you know what I mean? So they're taking good care of themselves.
So the pregnancy itself is not necessarily going to increase the risk for consequences from COVID. It's women who are pregnant who have other morbidities, other kind of illnesses like, whether it's heart disease, high blood pressure, asthma.
Yes, that is correct.
And then, you think about the transmission from mom to baby. Is it possible that during pregnancy, if a mom is COVID positive, that she can pass it on, the virus to the baby?
That's a great question. And the answer is we don't know. From the little studies and the little knowledge that we have, there was one little study that was done in China, and there were only 9 patients. And they tested the breast milk, the cord blood, and the amniotic fluid. All 9 were negative. And these were women that had COVID positive and had symptoms, and they were sick. So out of the 9 of the people all tested negative. In other words, the babies tested negative. There was another study that had 30 babies in that study. 3 were positive, and they tested like breast milk, again, same thing, amniotic fluid, placenta, and they tested positive, but we couldn't discern whether or not it was really transmitted from the mother to the baby or that the baby was handled with people that already had COVID. As of today, we don't think that there is any transmission between the mom and the baby, and that includes breast milk as well.
Well, Dr. Minaya, this is just great information. Thank you for keeping our mothers safe and delivering those babies and keeping them safe. Thank you.